Hello, good day. Welcome back to your medicals. So in today's video, I have something very short to share with you. I want to tell you something about antibiotics. Have you been in a situation whereby you just take an antibiotics for maybe 2 or 3 days and you are not seeing the effect? You change it to another antibiotics and it's still not working, and you change it to the third antibiotic this time 2 or 3 days, and probably maybe you are seeing a mild effect or nothing, and you seem to throw it away. Well, this is what we call antibiotic abuse, especially when you are taking multiple antibiotics without a prescription. In other words, you are taking unprescribed antibiotics. You are just prescribing antibiotics for yourself. There are actually many effects of this. It's a bad habit, it's a bad behavior. There are many effects of this, but among all the effects, I'm just going to tell you one. Why do I choose to tell you this one? Because this is one of the biggest of antibiotic abuse. And what is it? Before I mention that, make sure you subscribe. After you subscribe, tell me, then I will continue. Okay, so the biggest effect of antibiotic abuse is what we call antibiotic resistance. Yes, antibiotic resistance. Antibiotic resistance does not just happen. There are practices, there are behaviors, there are habits that you do over time that causes your body to develop antibiotic resistance. If you wish to know more about antibiotic resistance, please watch this video. Allow me to explain this. Is antibiotic resistance. Yes, antibiotic resistance. Your body is now resisting some antibiotics. Some antibiotics is no longer working in your system. Yes. And how do your body start reducing? How do your body develop antibiotic resistance? How did that one happen? I'm going to tell you. Number one, consumption of antibiotics unnecessarily. Every small thing, antibiotics. Every small thing, antibiotics. Any small thing, antibiotics. You don't even do tests. Well, you don't do tests to know the sensitivity of. It's not every antibiotics they're going to work for. It's not every antibiotic they're going to work for every bacteria. So if you do tests, you are more likely to use the right antibiotic for the right bacteria. Instead of you try this one, it doesn't work, you change to another one. When you are using multiple antibiotics, you are exposing your body to antibiotic resistance. When actually you get infected and those simple drugs that are supposed to work for that infection are no longer going to work because antibiotic resistance has set in due to your multiple use of antibiotics. You may need to use another new drug, and this is financially tasking and it's difficult to treat when there is antibiotic resistance in your system. So you may need to stop taking antibiotics unnecessarily. Please take antibiotic when it's prescribed for you or when you have done the appropriate test. Okay? So another reason why how you expose your body to antibiotic resistance is what we call skipping of medication, skipping of your antibiotics. Let me explain this to you. When we talk about skipping of antibiotics, if antibiotics is given to you probably 8 hourly or 12 hourly, your doctor tells you to take this medication, take this antibiotic 8 hourly or 12 hourly. What it actually means is that when you first take the first dose, those microorganisms, maybe 50% will be killed. It's not all of them that will be killed when you give the first dose. So those ones that are remaining, they will now be weak. I'm just trying to illustrate, trying to demonstrate. They will now be weak, they are now weak. And if your antibiotics is 12 hourly, in the next 12 hours, there's something we call bioavailability in pharmacology. That is now, in the next 12 hours, these drugs is likely to be going out of your system. And because these drugs is likely to be going out of your system, the bacteria, the ones that remain, they want to stand up, they want to wake up. So you are expected to knock them, these antibiotics, again in the next 12 hours. So in the next 12 hours, if you miss this dose because you don't take it serious, because you think we are fine, because you are sleeping also, if you mix this dose in that next 12 hours, those antibiotics, those bacteria, by that time the first dose have gone because 12 hours is passed and you did not knock them the second dose for them to die again. So they will not wake up, they will not be like, they will talk to their brothers and sisters. Hey, what happened? Which antibiotic they knock us like that? Oh, more strong. Oh, more, see, this person don't die. See, this my guy don't die. So now we survive. Them that survive, they will now come together. They will now release some enzyme. They will form something like a clone, and that is how resistance starts. such that when you now give the antibiotic, when you even realize and give the antibiotics again, it's no longer going to work. Or even if it works, it's going to be minimal. It's no longer going to work because what you have sensitized them, and they have produced enzyme, a kind of antibody relating to that particular antibiotics that you get them at that first time. So that is why if your antibiotics is 12 hourly, you must take it like that. That is the right way to take it. If you skip medication, don't skip antibiotics. If you're skipping antibiotics, you are exposing your body to antibiotic resistance. Okay, the third reason how you expose your body to antibiotics resistance is by underdosage. That is, you are not taking the right dosage. That is why if you want to take antibiotics especially, you need to get the prescription from doctor. If you take a dose that is not what you're supposed to take, if you take on the dose to your system, it's not going to kill those bacteria. In fact, you're even doing more harm. It's better you don't even take antibiotics than taking on the dose, because when you take on the dose, you are sensitizing those pathogens in your system. Because the dose or the antibiotic that you give in your system it doesn't have the power to kill them, but they will receive the signal. They will feel that in there. It will be like a vaccine. They receive a vaccination, so they will form antibody against that antibiotic, so that next time it's not gonna work. Even when you wake up from your sleep and they kind of know that I'm giving on the dose and I need to increase the dose. When you increase the dose and give the antibiotics, it's no longer gonna work. It's no longer gonna work because you have first sensitized them, and they have formed a clone. That is why usually the first dose of antibiotic we normally give. Sometimes we give a higher dose. After the higher dose, there is something we call maintenance dose. So this is the stuff behind that higher dose I just explained to you. So that is the reason why or how you expose your body to antibiotic resistance. And the last reason I must mention to you how your body develops antibiotic resistance is when you don't complete your antibiotic treatment. If you are on antibiotics, if you are taking care of some infections and you are on antibiotics, you are supposed to complete your antibiotics treatment. Even if it's 14 days, it's 10 days or so, you are supposed to complete it, even though your symptoms stop. If your symptoms stop, it doesn't really mean that all the bacteria in your system have been eradicated. No, it simply means that most of the bacteria, probably let me say 90% of the bacteria, have been taken care of in your system. So that is why you are no longer having those discharge and those pains and those symptoms relating to your infection. However, 10% are still remaining in your system. These 10%, they don't have the power, they don't have this, they are insignificant to cause you those symptoms, but they are still there. And when you stop taking your antibiotics, these 10% are going to multiply depending on their incubation period. After a few days, after a few months, after a few hours or stuff, you are going to be reinfected. But the worst thing this time is that when these bacteria multiply and you come down with this same infection again, it's no longer going to be like before. This time it's going to be worse because of what we call super infection. And talking about this super infection, the symptoms is going to be worse than before this time. And if you use the previous drugs that you have used to treat this particular stuff the same time and you want to apply it this time, it's not going to work because of this same issue we're talking about, antibiotic resistance. You have sensitized this antibiotic. They have formed a kind of antibodies against this specific antibiotic that you give them. So they are like soldiers. They are now ready. They have woke up from their sleep and they are ready to fight. And it's just like the same thing we do when we're talking about vaccination. When we're talking about vaccination, you give a vaccine so that your body develop antibody against that particular disease by which this person gets vaccinated. So if you are not completing your antibiotic regimen, you are exposing your body to antibiotic resistance. Any antibiotic you introduce to your system needs to eradicate those bacteria by which you take them for, because if not, those bacteria will form resistance against that particular one. You are at risk of antibiotic resistance. More videos like this are popping up very soon, so you may need to subscribe to this channel so that when more videos come, it's going to pump up on your phone. Thank you.